My name is Cindy Latanzio. I'm the owner of Scout, well, myself and my daughter. He's a 12-year-old Australian cattle dog. His arthritis was very progressive. It started out slow, but just got worse and worse and worse. He never wanted to slow down, though. He kept trying to keep up, and the day after he would spend a day at the barn, he would be extremely lame. About a year ago this time, he had gotten so bad that I started to prepare my daughter that I thought maybe by the next winter we might have to euthanize him. Not only had he stopped playing with my other dogs outside, he laid inside and just developed this very dull look in his eyes, like nothing interested him anymore. So we decided to do a kind of all-out treatment on him and see if we could improve him to the point where he would at least enjoy his life a little bit. He had been on a joint supplement, glucosamine and chondroitins, and had been on, we tried a couple of different NSAIDs that the vet had prescribed for him. We also started him on weekly Adequan injections, and I brought him every week to the vet and alternated 1 week acupuncture and the next week chiropractic work. And we also started twice a week and then dropped to once a week, hydrotherapy with a physical therapist who put him on an underwater treadmill and did a lot of physical therapy work with him. We did that for several months, and I would say the improvement was marginal. He maybe looked a little bit better, but certainly not that I thought we were going to extend his life and really take away his pain. Dr. Flint had been treating Scout for some time, and I had all along been expressing my concerns about his quality of life and how low I thought the quality of his life was. And he said that he had learned of CPET and thought that maybe Scout would respond to it. I really didn't have any concerns about getting it done because at that point I thought I had nothing to lose. He's doing great now. He's still an old dog. He has a lot of general stiffness because he has arthritis in his spine and in his hind end and both front legs. So he's not going to run and jump in the air and stuff, but he's back to enjoying life. He goes down to the barn with me now and trots and even does a little running by himself. He's playing with my other dogs, and he has a spark back in his eye, and that's what was gone. It was the dullness in his eye that just broke our hearts. I went in about 2 months later and said, it's a miracle. I just was so thrilled with the difference in my dog, and that's the word I still use today, that I thought I would have to euthanize him last winter. It's now the next summer. He's still going strong, and I don't know, I hope we still have a long time with him.
I'm Marilyn Lazar. My dog is Thumper. He is a pit bull mix. The reason for choosing CPET, I feel it's a more holistic approach to a very common problem, particularly in dogs with their legs. He's got a lot of arthritis. I don't believe in the steroids. I don't do it for myself. I'm have a more holistic approach and homeopathic approach for myself. And I really would prefer not to give my dogs drugs if I don't have to. I did not expect that quick a result. However, it was only 3 days. The procedure was done on a Thursday. Sunday morning, the dog realized he could actually put his foot down and walk on it without much pain, and we walked for 2 miles. He was up at the dog park. He found a dog that he literally 20 minutes worth of kids would be roughhousing. The dogs were roughhousing. He was up on his hind legs, both of them, kind of like a boxer, boxing and playing with this dog and running. I got him home, and I was prepared for the typical limp that I've had over in the past. There was no limp, none whatsoever. And now I don't hesitate to take him. He just seems to be a happier dog. I don't think he's in the pain that he used to be in from the arthritis. And for him to be able to play 20 minutes and no limp, that was huge, absolutely huge. I was thrilled to find that my vet was very accommodating when it came to performing this procedure in her office. And she was very into it. She was very thrilled to see on examination prior to the second treatment that he did have a significant improvement in the range of motion in his right hind leg. I would highly recommend this procedure for anyone during surgery or for this arthritic reasons. I just had such a dramatic effect on it had just such a dramatic effect on my dog.
I'm Jocelyn Oddie, and I'm the owner of O'Malley, who's a 9-year-old American Pit Bull Terrier. I decided to do the CPET procedure because she had originally had both of her ACLs surgically repaired, and that it did, cure most of her symptoms, about 90%, but I could tell that I still could not, continue with her daily activities as far as, ball playing or even just, chasing squirrels off the deck. So I felt like I needed, a little bit more to see that, if it would correct her symptoms. She was shifting her weight back and forth when she was eating her food, so I knew she was into some discomfort. She could not play ball without being completely lame the next day. She would limp and hobble along, and she would look like a much older dog than she really was. She was aging rapidly. I tried other therapies before trying the CPET, which included acupuncture, chiropractic, and anti-inflammatories. My first concern that I had asked my veterinarian was if it was safe for her. I did not want to put her through any major procedure or very invasive procedure because of her sensitivities. I wanted to be sure that it was safe and there were very minimal risks to her. Once the effects of the sedation had worn off, I saw a difference within 6 hours of the procedure. She seemed to be much more comfortable. Significant improvements started pretty much 12 hours after the procedure. She was standing a lot more sound. She was not shifting her weight back and forth, and just her overall movement was much more sound. I would absolutely recommend CPET to a friend, just due to the fact it's, an all-natural approach and a very non-invasive procedure. I can now go about interacting with my dog as if she were a 6-month-old puppy, playing every day and not have to worrying about whether she's in pain or discomfort.
For additional information, you can visit the Pall Animal Health website